Hi, this is Jeff Zeig, and here I am in New York City, where I've just completed a master class bringing you another 5-minute video tip for therapists. This time I want to theorize, I want to editorialize, I want to talk specifically about a philosophy, about techniques in psychotherapy. I want to contrast medical techniques along with the social interventions that are central to psychotherapy. Psychotherapy has become medicalized, and we begin to think in medical terms when we're doing psychotherapy, and it's my philosophy that that's not the best way to think about helping to empower people. In medicine, the physician applies a technique. Let's say that the patient has an infection. The infection will be treated by an antibiotic. In order to do that, the physician needs to understand why. Why does the person have the problem? What's the specific pathogen? Is it staphylococcus? Is it streptococcus? And then once you know what the pathogen is, you have a decision to make about what will be the medicine that you use to attack the problem. So the treatment protocol from a medical situation is outside in. The doctor applies a technique. Now, psychotherapy has been medicalized. So let's say the patient has a social phobia. You diagnose the social phobia. You have a protocol for working with the social phobia, and then you provide the protocol, and you have an empirically validatable result. In my conception of doing experiential therapy, the job of the therapist is not to ask why. We don't need to know why the person has a social phobia in order to treat the social phobia. We know that every person who has a social phobia has experience at being able to manage their tension, experience at being able to distract themselves, and experience at being able to tolerate uncomfortable situations readily. Ability to relax. So our job as a therapist in a social intervention is to awaken the client to the components of resources that exist within the client's context, within the client's history, within the client's perceptual reality. In order to do that, we can realize that techniques of therapy do not cure. Techniques of therapy are ways of awakening conceptual realizations. To think that hypnosis cures anybody is an epistemological error. I'm an expert at hypnosis. I love hypnosis. I've been practicing and teaching myself to use hypnosis for well over 40 years, but I don't think of hypnosis as a way of curing people. It's not a technique that you use to apply to someone. I don't think systematic desensitization cures anyone. I don't think EMDR cures anyone. These are ways of helping people to reorganize resources that already exist. We are eliciting, we are stimulating into play realizations. As we stimulate into play these realizations, suddenly the person realizes, of course I can. Of course I can adequately resourcefully deal with whatever the situation is. I can move from a maladaptive state into a more adaptive state. Now, in order to do that, we have to think that therapy is about creating evocative experiences that empower people, evocative realizations that empower people, and basically what we're using is the topic of one of the previous 5-minute videos, which is limbic communication. We're trying to reach deeper into the brain functions where problems may exist and trying to help people to empower themselves. This is not a matter of technique, because there are myriad techniques that could be used, all of which can have a salutary result. Any technique that you use, for example, for some people in treating depression, what they would do is systematic desensitization of anxiety, and that can be a successful way of helping people to realize that they don't have to be plagued by their anxieties. I know that that's an unusual way of thinking, that techniques of therapy don't cure. Reframing doesn't cure anyone. Using desensitization, again, that doesn't cure anyone. They offer the person the opportunity to access resources that have been previously dormant. Psychotherapy could be defined as reorganization of experiential resources that can help people to transition from what has previously been a maladaptive state into a state that is more adaptive. So when I am doing therapy, I'm not thinking about applying a technique. When I'm doing hypnosis, I'm not thinking about applying a technique. It's a way of moving around to elicit the potentialities that already exist inside the client. Think about this, come to your own conclusions, your own philosophy about this, and see that an experiential therapy can be invented for each case, for each client, for each family, for each particular circumstance in which you're not taking something and medicalizing it, but thinking about the possibilities, the potentialities that exist within the client and stimulating them into play. Stimulating them into play, I mean in all senses, that therapy is a matter of helping people to recreate their experiences that have been dormant in constructive ways. This is Jeff Zeig, New York City at the moment, with another 5-minute tip for therapists.